This is Claudia, and she's been born with an atrial septal defect. Atrial septal defect is a type of congenital heart disease where a hole in the interatrial septum is present at birth. This therefore allows oxygenated and deoxygenated blood to mix between the left and right atriums. During normal fetal heart development, a tissue known as a septum primum grows inferiorly from the top of the heart until it fuses with the endocardial cushion. This closes the gap between tissues, known as the ostium primum, as well as separating the left and right atrium in the process. It is then a new opening is formed in the upper part of the septum primum, called the ostium secundum. These openings in the septums is what create the passageway known as a foramen ovale, which allows oxygenated blood to travel from the right atrium to the left during fetal development. This is required as a fetus can't oxygenate their own blood. Therefore, these openings source blood directly from the mother's placenta. Typically, at birth, the septum primum and septum secundum fuse to create the interatrial septum. However, this sometimes doesn't fuse correctly, leaving the foramen ovale open, allowing blood to travel between the two atria. This is an atrial septal defect, which results in a number of unpleasant symptoms. This is a future adult Claudia, still living with atrial septal defect. And this is her boyfriend. He's a dick. Unfortunately, due to inefficient flow of oxygenated blood throughout her body, Claudia can easily get fatigued. Here the poor girl is having trouble making it up the stairs. This is because she experiences heart palpitations caused by her heart's irregular rhythm. Atrial septal defect could also result in swollen feet. This is because Claudia's poor venous return causes a retention of interstitial fluid in the lower abdomen.
Where are you running, my love? Through the back streets of the city.
After such a harsh breakup, Claudia is headed to the gym to let off some steam. The problem with exercising is that Claudia is prone to shortness of breath. This is due to the inefficient flow of oxygen throughout her body. And if the atrial septal defect is really bad, Claudia could have deprived oxygen flow to her brain and, well, have a stroke. Luckily for baby Claudia, this is what could happen to her, because fortunately, all this can be prevented through early treatment. Traditionally, open heart surgery was required to close an atrial septal defect. However, now, cardiac catheterization is used to treat the condition, barring exceptionally large holes. This procedure is far simpler and more effective compared to the traditional method. It is also possible for a defect to close naturally, if the hole is small enough. During the cardiac catheterization, a long thin hollow plastic tube called the catheter is placed into the coronary artery through the patient's groin, arm, or neck, and into the chamber of the heart. A special dye is then injected through the bloodstream to make the hole visible in X-ray images. This enables surgeries to measure the size and exact location of the opening, so that they can use a specialized device to close it. This device consists of two connected mesh patches that cover both the left and right atrial sides, and within 3 months of the placement, the lining of the heart wall grows over the patches and seals the hole completely.